the timer, and here is your question. I don't know if the scenario we will discuss if I've written it right. If I should make it a more alarming, like gangrenous. Okay, so if you have read and understood, considering it clinical examination session, kindly begin.
Okay. I will enter. I wash
Yes.
my hands.
Yes.
Good morning, sir. I'm Dr. Kolade, I'm one of the exam candidates. Can I confirm your name and age, please?
Yes, I'm Smith, 72 years old.
Hello, ma.
Yes, I'm Smith, 72 years old.
Hello,
Begin.
ma.
Yes, begin, please. Can you hear me? I said Smith, 72 years old.
Okay. Okay, all right. Okay. Today I want to examine you. I will need to examine your two legs, and then it will also involve me touching, looking, and then moving your limbs, and then allowing you also walk. Hope it's okay by you, sir.
Yes. Yes, continue,
Okay,
please.
right. So I would like to you to expose. So I'll make sure that the patient exposed from his mid-thigh down to the foot. So I'll tell him to lie on the couch. So I will start by looking. So I'll look for his from his leg, from his knee down to the foot. I will check the right foot where he has ulcer. I will note where the ulcer is, the extent. Then it has whether it has slough or necrotic tissue or clean granulation tissue, and then also know the edge of the wound. I will check also if he has other injury or laceration in any other part of his body, then the other part of his feet, and then also note if he has skin loss also. Then I will try to look at the sole of his feet, then use my hands to pat his tools to look at each of the web space to check that there is no other ulcer. So for the ulcer that I've seen, I'm going to check the fully examine the ulcer, the extent, the depth, the base of the ulcer, and then if the ulcer is also discharging or not, and also note the edge of the ulcer. So I also asked him to carry his leg up or lift both limbs up and check the posterior part of the foot to know if there's any wound on it. Then I will now check for sensation, for differential warmth from his leg down to his foot, and then also check for if he has tenderness in any part of the leg and then also the foot. Then after that, I will check the popliteal, the posterior tibial position, and then also the dorsalis pedis position, and then even the capillary refill to know that those pulses are there, and then compare it with the other side. After that, I will check for do the monofilament test, putting it on the sole. Usually the force will be on the tip of the sole of this big toe, and then also at the metatarsal edge of each of the digits on his sole also. Then I will also check for vibration sense by using a turning fork, and then tell him to close his eyes, put it on the medial side of his first metatarsal edge, and to tell me when he's feeling the vibration, and then when this vibration has stopped, I'll tell him to close his eyes while doing this, and then compare with both the right and the left. Then I'll also tell him to close his eyes and then also check for sensation on his legs and then the foot. Then I will check for movement. I will ask him to dorsiflex and plantar flex the ankle, and then we can invert the leg, and then the foot on both sides, and note the angle. Then I will tell him to come down. Then if he's able to walk, so if he's able to walk, fine. If he can't walk except with a walking aid, I'll also be noted. Then I also check his footwear to note whether there is any abnormality detected on one, or both of them has any deformity on the foot, on his footwear. Then after that, check for sensation, and then I'll check for reflexes also. The Achilles tendon, yes, the Achilles tendon reflex will be examined also. Then with that, I think I've finished my examination. Then I'll thank the patient, wash my hands.
Check for the pulses?
Yes, ma. I check for the pulses, ma. I check for the posterior tibia.
In between the finger toes, sorry.
Yes,
toes?
yes, ma. Yes, okay, I check, ma.
Sorry, I didn't realize. Okay, and did you check the sensation from the leg as well?
Yes, ma. I check for the sensation.
Okay, which pulses did you check?
The pulses that I check for the posterior tibia, dorsalis pedis, and then also do the capillary feed, ma.
And popliteal as well, maybe. Okay, and did you check for the temperature? Because I wrote that patient has non-healing ulcer. So did you feel for the
Yes, ma. I check for differential warmth, ma.
Okay. Right. Anything else? Right. Any special tests that you will do?
Yes, I want to evaluate the patient. I want to do wound swab, MCS. Then I also want to do
special examinations.
Special investigation.
No,
I want to do X-ray of the
special examination
of the right foot to note there is any bony involvement of the foot, and then I also want to do nerve conduction test also for the patient.
Okay.
And then
just a second. Can you present your history now? Examination now.
Okay.
Sorry.
So I've examined a 72-year-old man that present a known diabetic that presented with a ulcer on his left on his right forefoot. The ulcer is about 2 by 3 centimeter in the dimension. It has slopy edges with pale granulation tissue at the floor. There is no differential warmth around it and not tender. The posterior tibia and then the dorsalis pedis position are palpable. He has skin loss, ear loss involving both of his feet, and then there's also a slight atrophy of the right leg compared to the left one.
Okay, what are your differential diagnosis for this patient?
My differential diagnosis will include diabetic foot ulcer to rule out
okay, or all right. What investigations
would you
okay, what investigations would you carry out to confirm your diagnosis?
Yes, I want to do a plain radiograph of the foot, of the right foot, then also do a fasting blood sugar to know his blood sugar and then the glycosylated hemoglobin. I also want to do a wound biopsy for both MCS and then also for histology to rule out to know the causative organism, and then to know if there's any malignant transformation in the wound.
Okay, since this patient, since this patient has a non-healing ulcer, how would you confirm your diagnosis that it is neuropathic ulcer or venous ulcer or arterial ulcer? Yes, can you hear me? Can others hear me?
Yes.
Yes, I asked you, how would you differentiate if this ulcer on the patient's foot is neuropathic, venous ulcer, or arterial ulcer?
Yes, ma'am. For a neuropathic ulcer, usually the patient will not feel pain on the affected foot. And then there may also be some deformity involving the affected right foot in the patient because of the Charcot arthropathy. In arterial ulcer, usually there will be loss of there will be reduced or absent of pulses in posterior tibia and dorsalis pedis. I feel also long than normal. Then the patient may also usually the ulcer will be at the tip of his leg, of the toes. That's usually where the arterial ulcers are usually. Then for venous ulcer, patient may have varicose veins, and then the ulcer usually on the medial, on the gluteus area, usually on the medial lower part of the legs, ma.
Can you please tell me what are the treatment options or alternatives that you can offer to this patient?
Yes, ma. The treatment of alternative are non-operative.
Yes.
Which involves better control involving the endocrinologist to make sure that the blood sugar is well controlled, and then wound dressing that also involve the orthopedics, and then also the plastic surgeon using various agents to dress the wound, debride the wound also. Then the other, and then the also depending there is features of abscess collection, patient may need I&D. The other, if there is now gangrene involving the digit that is affected, then patient may need a ray amputation or a major amputation depending on the level of viability of the tissue.
Anything else that can be offered?
Then after, if the patient had amputation, patients will need to get a prosthesis so that he or she can go back to his life activities back, ma.
Okay.
Then physiotherapy also will be involved in the management of the patient, ma.
Yeah. All right. Anyone want to give feedback? Did you explain the positive findings other than the size of the wound that you told, size of the ulcer that you told?
Yes,
did you tell me that there were pulses were viable, pulses were feelable?
Yes, ma. I mentioned it, ma. I think
why would you be able to feel the pulses in a diabetic patient?
Yes, may not
with the wound,
ma. Usually for some of them maybe absent,
maybe on the
how
right, on the
severe
other. Yes, then you should maybe say it on the affected foot. They were not palpable,
yes,
but then you compared it with the other foot, so they were palpable. So this was very important to say. Also, yes, sensations. Tell me, you even checked with the tunic fork. There should be differences when you were telling me patient with the right foot on which there was ulcer, there should be decreased or diminished sensations.
Okay, reduced sensation or absence of sensation
compared to the other foot. So patient, once you are telling in exam, so always be careful, because here I have written on right foot, it's the problem. So if it's right foot or the left foot, or if no foot is mentioned, then you have to tell accordingly. If no foot is mentioned, then there should be the same result on both result of the examination on both sides. Yes, and if there are a foot mentioned, then you have to be careful to tell the differences accordingly. And you checked in between the toes. Did you say that they were normal? There was nothing?
Yes, I checked, ma.
Right. Did you also tell me, remember me to tell that I asked you if there would be anything else that you would do? If it's vascular or arterial examination, like in this case, there'll be Doppler present, and you will be expected to do the Doppler.
Yes,
you did not mention
duplex ultrasound.
Yes, you did not mention it. I asked you if there is something else you'll do. Yes, so this is important. It will be there, and you would know how to use it, and you would do it. So how would you appreciate the sound on the right foot, which has non-healing ulcer or is affected, and the other left foot?
I didn't get the question, ma.
How would you appreciate the sound of the Doppler once you're doing it on the affected foot as compared to the normal foot?
Yes, yes, ma'am. On the normal foods, there will be flow. There will be normal flow. Usually the monofilament flow. I'm not
Okay.
sure of the scanning of the why on the affected leg there may not be any, there may be monophasic or no flow at all.
Yes. Okay, good. Thank you.